Grossfield learned Dr. Hopland remains on the Diamond Princess tonight, while Jeannie Hopland was taken to a hospital in Tokyo, and now their ordeal is really raising concerns about the handling of the outbreak, and it's leading to an urgent plea to bring them home.
The Hoplands were separated this morning as Japanese health officials escorted Jeannie Hopland to Self-Defense Force Central Hospital in Tokyo. I spoke with Dr. Hopland, who says he's keeping in touch with his wife every step of the way. He says while Jeannie is strong and will get through this, he does have a number of concerns about this entire situation. A 2-week-long cruise, now a month-long disaster. The Hoplands have been through a whirlwind of emotions this past weekend after being initially told they would be leaving the ship, then finding out they had to stay after Jeannie tested positive for the virus. Officials back home are working around the clock to not only get the Hoplands home, but also other Americans on board.
Our folks are working very, very hard to make sure the U.S. citizens are taken care of, and specifically when you know someone in a situation like that, you want to reach out and do everything you can to help not just them, but all Americans.
Of the Americans returned to the United States Monday morning, 14 of them also tested positive for the virus.
The fact that we weren't amongst those 14 was just a happenstance that they caught us just as we were leaving the door. We would have been number 15.
Now the Hoplands are separated, something they had feared from the initial news of Jeannie's diagnosis.
The disease isn't the scary part. It was just the unknown of going into a hospital where nobody speaks English. She has no idea what the requirements are going to be or what her situation will be.
Dr. Hopland says they downloaded a number of translation apps on her phone before she was transported, but they still worry the language barrier will be a huge issue.
It was terrifying for her. She's going to be in a foreign country. She's going to have difficulty communicating with anybody medically. She wasn't aware if she was going to be totally isolated and in a single isolation room or what that was going to look like. So she was obviously very anxious.
However, her son is hopeful that the U.S. government will find a way to bring his parents home soon.
So I'm hopeful that she will begin her kind of supervision there and finish it in the United States, which will obviously make it easier to communicate.
Dr. Hopland says his wife is in a holding room with 2 other women, one of which speaks an entirely different language, but the other is American, so she's not entirely alone. As far as what the next steps are and when they can return home, those answers are still up in the air.
Kelly, thank you very much.